Perfect. Can everybody hear me? First of all, I wanted to thank everybody for coming today. It is so exciting to see so many people here. It really shows how the landscape in terms of healthcare, what I think we practice as disease care, is shifting to healthcare because so many people are here. You're here because you care about longevity, you care about health span, and there's a movement towards a greater place in terms of healthcare. You know, myself as a registered dietitian is my background. I've had the opportunity to practice the last many years in terms of nutrition. But one of the things that have always stuck out is this one size fits all. We've never really been able to personalize or customize health like we are today. So I'm so excited to have this panel here to talk about gut health, to talk about microbiome testing and how it impacts our longevity, our health span, and all around economy as well. So I'd like to begin by just having each of the panelists introduce themselves. If you could just take a minute, introduce yourselves, and then I'd love to begin our session. Harish, if you wouldn't mind just starting.
Sure, thanks, Raman. So I'm Harish Consul. I run a venture capital fund called Acro Ventures. We've got a huge focus on health and longevity around the globe.
Hi everyone, my name is Francisco Davila. I'm a research associate at the University of Calgary, and I have expertise in the microbiome field at aging.
Hello, my name is Dr. Raja. I'm the Chief Scientific Officer and Vice President for BioAero at RDI. And my background is in internal medicine, in cardiology, and for the last about 10 to 15 years I've been working in the space of precision medicine, personalized health, and how we can use microbiome for aging purposes.
Your mic is just...
Okay. I don't know if you heard me.
Take two. And thank you, while we're waiting, Momo, for your fantastic presentation. I think the big takeaway for me from that was one line that he said there, that, we are a 3D print from the foods we consume, and how important that foundation of nutrition and lifestyle really is in this space. Is it? Oh, it's... All right, Harmeet, do you want to introduce yourself?
I'm just going to test it.
Yeah.
My name is Harmeet. I'm a longevity coach and licensed practical nurse with BioAero and Near Precision Skin.
Perfect. And I think Harmeet is here today to give us kind of that patient journey, patient experience. So we're so excited to have you all here. Harish, if you wouldn't mind beginning, given your experience in strategic planning, what role do you think precision medicine and gut health will play in shaping future healthcare priorities and investments?
Sure, great question, Raman. So everything we look at, I talk about the 3 Ps. It's preventative, personalized, and precision-based. So precision health is huge. I mean, we are not interested in any company today if they're not precision-based. And, all of our gut healths are unique, our microbiomes are different. So, all of those biomarkers are being collected, the data analytics of all of us are being, uploaded to the cloud, and there's so many opportunities on precision health around the world, from everything from, diagnostics to stem cell therapy to microbiome companies to oral health. I'll give you a quick example if I can share. So we just invested in an oral health company in London. They send you a quick saliva test and you send it back and they give you personalized toothpaste. This is where we're going. I mean, the whole world is entering into this personalized, precision-based healthcare. It's very exciting.
It is very exciting, and I think it's where we need to be because, something that Momo said that really also stuck out was that we're not average. We can't look at these guidelines where it's about the average person. Every one of us is unique, and each one of our makeup is unique. And in fact, our gut microbiomes are as unique as our fingerprints. So I completely agree with you on that. Francisco, maybe I'll come to you now. You've done a lot of research and things. Based on your research, how can insights from microbial metagenomics be applied to develop personalized gut microbiome interventions for enhancing lifespan?
Yeah, that's a great question. So based on the research I have done, it's like we used the whole information that is encoded in the microbes in the gut and in your oral and the skin. So if we have that information, so we can personalize actually kind of food we can eat. So if a specific treatments we can also get. So for example, there's new research about by some cancer therapies that affect or actually interact with the microbiome, right? So so it will be really essential to understand which microbes, which genes, which functions do we have in the gut, so then to deliver the proper treatment for cancer, for example. Right?
Amazing, and I think that's a little bit what Momo's talk spoke to as well, this personalization piece and, some of the Nutrition 2.0 that he spoke to. Momo, do you mind if I come to you next for a question? So I was wondering, precision medicine is wonderful, gut microbiome is wonderful, and if we could all access it would be wonderful, but sometimes these tools can be quite expensive. How can we ensure that innovations in microbiome testing and gut health innovations are accessible to more people, not just those of maybe of a higher income level? Oh, just 1 second, Momo. I think we're just adjusting the audio. Give us 2 seconds. Are we good? Can I get a thumbs up? We're good?
There's an echo, but maybe only I can hear it. Okay.
There we go. We're good.
Okay, so yeah, I've been working on this question for 14 years. I wanted to make sure that it's accessible to everyone. And today, our test, for example, metatranscriptomic test costs $100 for a customer. If you're a scientist and you want to get metatranscriptomic tests done, it costs $1,000 or more dollars. So we've already reduced the cost a lot. What we're working towards, and we will not give up until it's done, is that all of the Viome services will be free to the users. And the day that they're going to be free is when we prove mathematically with health economic data that this is truly preventive medicine, meaning that if a payer pays someone to get on Viome services and they spend a certain amount of money on them over a period of a certain number of decades, that they will prevent type 2 diabetes and Alzheimer's, and the lifetime healthcare spend of that person will be less than what they invested in Viome. As soon as we can prove that there's a return on investment, then payers should jump on the bandwagon of, okay, we're going to provide Viome services for free instead of paying more for health. I don't know.
We're just having a bit of feedback. Sorry about that. I think we're having, and I think my mic is off now, so. But I can talk loud enough that everyone can hear. Until we're kind of working on that feedback, can Momo speak now, or should I move on till we get that settled? Maybe while that gets settled, I can talk to Parmeet here. Parmeet, maybe you can tell us a little bit about your journey. Tell us how things like precision medicine, things like gut microbiome testing have, affected your life personally.
So I can. Hello. Testing. Okay. So I can talk a little bit about my journey. So I was actually diagnosed with ulcerative colitis in 2018. I was only 19 years old. I was just finishing nursing school, and I had blood in my stool, and I was like, okay, what is this? So I had this huge flare-up, and I got admitted to the hospital, and it was tough. I was there for 7 days. I was given prednisone, the IV, on anti-inflammatories, and when I finally got out, I was just on the anti-inflammatory because the prednisone obviously got rid of all the symptoms. And then COVID hit, and then once COVID was done, summer was open, everyone was going out, so I started eating out a lot, I started drinking, and I was causing a lot of stress on my gut, obviously, and I had another flare-up. So I was like, okay, now I have to go round 2 to the hospital and, be on prednisone again, all over again. So prednisone, again, did heal my symptoms, but they weren't fully resolved. So, during that time, you had to get the COVID shot, so I was in my healing stage. And as a nurse, you had to get your COVID shots before you could start work again. So I got my COVID shot and it flared up again. So it was a whole bunch of trial and error. I tried suppositories, I tried, steroids, I tried so much, and my doctor was like, no, you have to start on biologics. And I was scared, and I was like, what's biologics? You know, it's scary, like I don't know what it is, I don't want to start it. So I was trying to avoid it and just try other things. And there was a lot of trial and error there, so I was like kind of giving up, and it was going on for 6 months. So then I was like, you know what, I'm just going to start the biologics and just hope to God that it works, which it did. So I was on Entyvio, and I was on it for 2 years. And I was like, I don't want to just, you know, heal my symptoms. I want to know the root cause of why I have this. You know, like no gut issues run in my family, none of that stuff. And it just randomly occurred to me. So I was like, what's going on? I want to know. So that's when I actually did the BioGut program. And that's where I did the gut microbiome. So it's the stool test that you can ship out, or you can drop it off to the clinic. And within 2 weeks, I got my results, and I was able to tell what's actually going inside my gut. So I was avoiding dairy, I was avoiding all these foods, I was just sticking to a basic diet, which I was eating every day, and I was scared to try new things because I was scared I was going to flare up again. So I actually found out that I'm actually not lactose intolerant for my gut microbiome. It's just that there was other imbalances in my gut that were not allowing me to digest dairy or all that stuff. So I couldn't even enjoy butter chicken or have ice cream or none of that stuff. So with the BioGut program, actually, so it's a program where they look at mental health, they look at your nutrition, and they look at your exercise. And I feel like all those three contribute to your gut health and IBD and IBS all around. And actually, if I tell you now, like I'm working on balancing my gut, but I stopped my infusions and I've been okay. So I'm really proud of that. So honestly, if anyone out there that's struggling with IBD or IBS, I would highly recommend the BioGut program for sure, because it actually changed my life.
Thank you, Parmeet. That is very, very powerful, and it's amazing the power of lifestyle intervention, understanding our individual blueprints, as we can say it, and you know, it's trying to move away from this trial and error approach, because I think that's what the root of precision medicine is we have this trial and error approach where this might work and this may not work. We want to now bring it down to the root cause. And now, if I could ask Dr. Raja a question, you know, you work quite closely with patients on a regular basis. In your experience, how receptive are patients to gut health interventions as part of their health plan? What are some ways to encourage them and help with, you know, effective ways to help them manage? And what would you say some of the most common forms of dysbiosis you're seeing?
Okay. So my mic is working, I guess.
Yes, it is, yeah.
Okay, good. So I think that's a very loaded question, but it's a very relevant question. The receptiveness of the patients is very profound. I think the ordinary human being who's looking at staying healthy, not just, you know, somebody who is having some health issues like the way Parmeet was describing, even the common person who just wants to stay healthy, they have come to that point where they know that the microbiome is something which is going to make a profound effect on their health and well-being. And so the reception of the patients and the general public is quite high. It goes back to something related to awareness as well, that some of the earlier speakers talked about. David gave a very good presentation. There was a lot of technical information in there. But I think he also brought it down to the level of the layman, where the layman can understand that. So as long as the layperson can understand the science behind what we are talking about, they will be more receptive to accepting it, rather than the quackery, where we go around saying, you know, this thing will work or this thing will work. Momo touched upon a few of those things as well in his presentation about the patient being able to learn from the science and accept that. And so I think a lot of that reception comes from the awareness that we create in the general public and the science behind it. Because the awareness has come to that point where if there is no science behind the work that we are doing, the uptake of or the adoption of that will be a bit of a challenge. And then a part of it also goes to something I think that we discussed about yesterday evening around the policy-related issues. In those policy-related issues, I want to do something. I want to, you know, get a test done, or I want to take some sort of a treatment which is based in science. But if there is no reimbursement for that, then I will probably be hesitant if it's being very expensive. So I think the receptiveness of the patient and their ability to uptake some of these treatments is driven by multiple factors. But you know, like how Parmeet was mentioning, there are patients who are struggling, and they get to a point where they're saying, I really don't care if there is reimbursement or policy for this or not, I need it today, right? So all these researchers, clinicians, policymakers that are sitting in the room here talking about these things, we always have to be cognizant of one fact, that there is a patient on the other side, there's an end user on the other side who's looking for an outcome from whatever we are doing. And that helps basically improve the receptiveness and the uptake of some of these technologies that we're developing.
Amazing, that absolutely, I think, encompasses it. We're down to our last 5 minutes, so what I was hoping is if each panelist could just highlight maybe one key action or takeaway message, as well as a call to action to each person in this room. What would you see that call to action be to help progress this area of longevity and health span and microbiome testing or whatever that case may be? So Harish, maybe we could begin with you.
Sure. I think, the biggest call to action is having more events like this, honestly. Like, we never had, health and precision care and longevity events. I used to go outside of Alberta because it wasn't in Canada. We travel the world and speak at some of these events, and this is an amazing venue to have this event. Look at the experts in the room, and the more awareness we have, the more education we learn about, incredible stories. I mean, there's thousands and thousands of stories like that. People just don't know. So I think we need to, raise that whole awareness around the globe and talk about the success stories, because this is where everything is going.
Absolutely. So definitely increase awareness, talk about the success stories. Francisco, what about yourself?
Yeah, you asked for one, but maybe I can say two, right? So, so the first one I would say by collaborate between us, but also like there are tons of scientific research and also clinical trials that need volunteers, right? For samples, for skin samples, for gut samples, right? So it is important to everyone participate on those, because in that way we can develop those strategies for treatments, right? And the second one, I would say by educate yourself. So it's like read a lot, know your own body, and also try these 8 lifestyle changes, right? Like exercise, sleep, and manage your diet. So yeah.
So education is very important, and you think of that gut microbiome and that vagus nerve and how, just like the name, it is so vague, and how it impacts so many aspects of our lives, whether it be our skin health or our gut health or our mental health. So, really does play a very pivotal role in our overall longevity. Dr. Raja?
I think Francisco spoke for all of us.
Okay.
Dr. Kapoor mentioned about something yesterday evening where he said that our current management of patients is reactionary. I think one of the call to actions has to be that we have to move our patient management a bit more upstream and make it more preventative and predictive and prognostic. And a large part of that would come from enrichment of the data that we have. So going back to the point that Francisco was making, collaboration is going to be very critical, where many different groups, companies in the private sector and the public sector are generating tons of data. The collaboration will allow us to enrich that data and help make our management of patients more preventative rather than reactionary.
Excellent. And Parmeet?
Just like Harish was saying, again, education is what we need, spreading awareness. I feel like there's so many patients out there or people out there that are actually diagnosed with IBD and they're getting their colons removed, they're getting like ostomy bags, and it's like no one wants that. So I feel like just spreading that education and like sharing personal experience is what will make someone relate to you and be like, it worked for them, maybe it might work for me. And that's when they will start doing more of their research and you getting their education. And us doing our job is by spreading that awareness. I feel like it will help a lot of people.
Thank you for that. And do we have Momo virtually there that he could give his, last call to action? Or in the meantime, while we're waiting, these call to actions are phenomenal. I think it's really important that each one of us embrace them and really move them forward. And one of the opportunities we have today to really work on our personalized health or our self-care is we are offering microbiome tests to everybody in the audience today. So please do go visit the different booths. Each
Yeah, I
booth has
still cannot
kind
hear
of...
you. The host is muted on this channel.
Sorry, can you just... Momo, can you hear me?
Yes, I can hear you, but then there's that echo.
All right, so let's try that one more time. if you could share your call to action, that would be absolutely incredible.
I'm not sure I understand what I...
So I was just asking all the panelists, just to help us wrap up a little bit, if each one of them could provide us with a take-home message or a call to action to the audience. So I was hoping if you could share your insights into that, what would be a call to action or a take-home message that you would like to share with the audience today?
Yes, very excited to share that. Okay, so first of all, have the conversations about this topic with your friends, family, colleagues, everyone, social media. Start sharing information about how important nutrition, exercise, sleep, and Zen are for prevention of diseases and cancers. So that's first layer. Second layer, whatever your professional area is, you can always help this whole scientific effort by providing some kind of at least verbal support to this kind of scientific efforts, because there's a lot of resistance from the current established healthcare system and pharmaceutical companies for this sort of revolution that's happening in preventive medicine, because the current system doesn't benefit when people are healthy. The current system benefits when people are sick. And so there's going to be a lot of resistance to this sort of approach. So provide your voice in every possible venue that this is what we want, this is what people want. And so if you're also at a position where you're at a university or a company, every day think about how can you enable this kind of scientific approach to health, to improving health span. If you think you're just an administrator at a university, that's not just an administrator. You can actually enable this kind of science to happen. You can talk to the IRB committees or ethical committees to work with researchers to more easily approve human subject research. That's been one of the reason why all these studies are done in mice is because the ethics committees worldwide tend to generally be very negative about doing human clinical research. They tend to be on the risk aversion side, so they don't approve studies that we would benefit from. So just that aspect, how can you help your local ethics committees and your government organizations work with ethics committees to actually enable science, not to disable science in human research, because that's what we need more of. Anyways, could speak for a long time about this, but those are the main topics.
I love that last statement, that we really want to enable science. So that I think is really, really important. I would like to thank all the panelists for their insights today, and I would like to open up the audience for any questions if they're interested to, ask a specific panelist a question or just generally a question. I do see some hands up, so we've got some mics that'll come around.
Hi, my name is Chadna, and I'm not a professional that works in the medical field, but I'm always curious to learn new things and to meet new people, so I'm really excited to be here. From a layman's perspective, or an average person that is not in the medical field, how would you address people's concerns in terms of where this data that is collected is going, the ethical use of this data? I think a lot of people have fear around the super quickly growing AI technologies and the way that we're using AI and the way that we're collecting all this data really on humans, and where is this going and how is it being used and what does it mean sort of in decades to come, right?
That's a fantastic question, Dr. Raja. I wonder if you could take that?
Sure,
You'd be interested too?
Absolutely. I think that's a very timely and very relevant question, and a part of it was discussed yesterday also. At BioAero, for example, I can speak about us. We take pride in this thing that you are the owner of your data. We are the custodians or gatekeepers of your data. And we employ a very high level of encryption to protect that data from any hacking or any other scrupulous interventions that somebody might hack or break into it. The other thing that we are working on is that we are developing our own blockchain that you would have heard about yesterday, which adds another layer of quantum resistant hacking to it. So that even, it doesn't really protect against quantum hacking in the future, but it adds an additional layer that protects that data or delays that hacking. So that's the approach that we are taking, and we hope that others would take that data as well, because something relevant to the question you're asking is that
we all tend to think that we can anonymize human data. We can, but we can never anonymize completely any genomic data. And that genomic data, for example, I always cite this, there is a Golden State case where the FBI used 23andMe's database to actually track down a killer from 30 years back. So even though somebody is claiming that they have anonymized your data, they cannot purely do it. The only way to protect that is either through creating an NFT, where your data is turned into a non-fungible token and you are able to track who is using your data for what. And the other way to do it is that you are basically the owner and custodian of your data. We are only protecting it or storing it for some time. So that's probably the best way to approach that question.
We've got, thank you so much for that. I think we can take a couple more questions.
I think one of the
We'll take this one, and then I think there's one on this side of the room.
Hi, panelists. I'm Jacques Duprier, family physician with an interest in lifestyle medicine. To any of the panelists, can you maybe elaborate on the magnitude of fluctuations in data points we can find in our microbiome, which is how quickly those data points change? So, for instance, if we've done a test this week after a nice healthy lifestyle and lots of sleep, as opposed to a test after 2 weeks of stressful work schedules and not sleeping much, how does that picture change? Thank you.
You want to take that?
Francisco, would you like to take that?
Yeah, well, that's a great question. So actually, you may know that for example, the gut microbiome, I just speak of the gut microbiome, change every single day, right? Depending on what we're eating, or if we're sleeping, or if it's a day or night, right? So one of the things that we were working in BioArrow is that we can do this longitudinal tracking every 3 months. So because it's the BioGut program, how it works, so we take the gut sample, and then how it is the initial point, and then after 3 months, after all of the changes, the exercise, the lifestyle changes, the diet, then we collect another sample 3 months later, and we can easily compare the difference between those and if the program is working or not. So we can speak on that, and then 3 months we tested that it's a proper time for testing again. Yeah.
I can very quickly add to that you know how our body has a circadian rhythm? Our cells have their own circadian rhythm.
And our gut microbiome also has its own circadian rhythm. And so that goes to the point he's making about the fluctuations you will see, how you're talking about the stresses that we go through on a daily basis. That gut microbiome also goes through a circadian rhythm. And that influences the release of various metabolites that act as signaling molecules even for our brain.
Thank you so much. And we'll take one last question, and if there's any questions after that, the speakers the panelists will be available for you to connect with them for sure. I think we've got one in the front here.
Hi, Dr. Bob Schultz, asking School of Business. Do you think it's possible that you take what you're doing and reprogram all the people who are playing with mice and doing all the pharma trials? Because there's lots of expertise in that area, but I think we all agree that they're kind of misdirected. Because anything that you're doing is going to undermine a lot of things that other people have their own personal values in. So where do you start in terms of trading people's careers?
That's a very good question. Who would like to
It would
take
take a
that
long time to
one?
answer that, but give it a start.
I think we can give a lecture on this probably. Harish, do you want to take that?
Yeah, it's a pretty controversial topic because, and we could spend days on this. So we're seeing in the lab today, these Yamanaka factors and epigenetic changes, and they're reprogramming mice. They're doing it in monkeys now. We're in human trials. Is it ethical? Is it not? Where do you focus? There's a lot of crazy stuff going on. Like you said, where do we focus your energies? Some people don't want to change. So part of the problem is you've got this traditional medical system that the pharma companies and everybody's supporting, and they don't want to be preventative in terms of, because it changes their whole business model. So, it's a very interesting discussion, and I'm sure all of us can add to that.
Momo, is there anything that you'd like to add in?
Published a preprint paper on this specific topic. It's an opinion, it's an expert opinion article with a team of clinicians, scientists, foundation leaders, and so on. And so basically what we're proposing is that we shift our scientific shift our scientific efforts towards projects that are conceptually very similar to the Manhattan Project. If you guys watch the movie Oppenheimer, you understand a little bit about the Manhattan Project, but the concept of the Manhattan Project or Apollo Project or any of these large projects is to actually put together the world's experts and provide them with absolutely every resource possible, and they need to focus 100% of their attention on one thing, which is the goal of the project. They cannot be distracted by ethical reviews, publications, or logistics, or any of that. So this problem has already been solved. All we need is we need a different funding mechanism. Today, the governments spend many billions of dollars giving money to compartmentalized professors at tens of thousands of labs who all have their own goals, who have their own methods, who generate their own data using their own methods. And so we have this massive amounts of data generation globally, but they cannot be used together. And so all we would have to do is use the exact same people, pay them the exact same amount of money. No one's getting fired, no one's doing anything. It's just that they all need to be grouped into one project so that we can say, okay, we're going to have a Manhattan Project for multiple sclerosis. Let's, in the next 3 to 5 years, ask everyone in the multiple sclerosis field, the clinicians, the scientists, the technologists, to focus on only one problem, which is what is the root cause of multiple sclerosis, so that 30 years from now, we can read about multiple sclerosis the way we read about the Black Death. Today, we read about the Black Death. It killed 1/3 of the world's population 7 centuries ago. No one knew why. It was religious reasons, magic, who knows what, right? But today, we know exactly what caused it, how it's transmitted, how to prevent it. We need the same exact mechanism for multiple sclerosis and Alzheimer's and type 2 diabetes and every other disease and cancer. And we have the technology to do it. We just have to change the approach. And I know how this can be done.
That sounds amazing. Like, that is definitely a great way to, that's a great perspective and great way to kind of put it. Thank you so much for that, and thank you to each and every one of our panelists for their insights today. And I do invite all of you to come speak to them, during our breaks, and please do visit all the different booths and make sure you get your microbiome tested and take that step to being the CEO of your own health. Thank you.
Fantastic. Thank you so much for this incredible panel. You have a 10-minute coffee break. We're starting at 10:50 sharp, please. But I also would like to give